Hello everybody. I am Dr. Atef Ahmed. I am here to introduce my new book with title Mastering Bariatric Surgery. Mastering Bariatric Surgery is a comprehensive guide tailored for medical professionals striving for excellence in the field. Drawing from extensive experience in bariatric medicine, the book provides insider insights, surgical techniques, and patient care strategies. It underscores the significance of grasping patient psychology, nutrition, and holistic care in achieving success in bariatric surgery. Key features include expert tips, a multidisciplinary patient care approach, staying current with clinical guidelines, addressing emotional and nutritional aspects, and personalizing practices for each patient's journey. Whether you're an experienced surgeon or a medical professional looking to expand your expertise, steering patients towards a healthier future. Embark on your journey to mastery with Mastering Bariatric Surgery. Thanks.
Welcome to Mastering Bariatric Surgery, Insider Tips and Surgical Strategies. This book is a comprehensive guide crafted for medical professionals, particularly surgeons, who are committed to the art and science of bariatric surgery. It's a unique compilation of insights, techniques, and strategies that have been honed through years of experience, research, and collaboration within the field of bariatric medicine. Obesity is a global health challenge, and bariatric surgery has emerged as an effective and transformative solution for many individuals struggling with this complex condition. However, the field of bariatric surgery is ever evolving, with new surgical techniques, clinical guidelines, and patient care approaches continually emerging. To excel in this dynamic specialty, it's essential to stay informed, adapt to change, and prioritize patient safety and well-being. This book aims to be your trusted companion in the realm of bariatric surgery. Within its pages, you'll find a wealth of knowledge, from fundamental principles to advanced tips and tricks. We've gathered insights from seasoned experts and pioneers in the field to provide you with a comprehensive resource that addresses the nuances of bariatric surgery. Our intention is not only to equip you with the technical skills required for successful bariatric procedures but also to delve into the holistic care of bariatric patients. We recognize that bariatric surgery is more than just a surgical procedure, it's a journey that demands a multidisciplinary approach. Throughout this book, you'll find guidance on patient selection, preoperative education, long-term follow-up, and the critical role of psychology and nutrition in patient outcomes. Whether you are a seasoned bariatric surgeon looking to refine your techniques or a medical professional seeking to expand your knowledge in this transformative field, Mastering Bariatric Surgery offers a valuable resource to enhance your practice. We encourage you to approach the content within these pages with an open mind and a commitment to excellence. Bariatric surgery is a field where innovation meets compassion, where science intersects with empathy, and where lives are transformed through dedicated care. We hope this book inspires you to continually strive for the best possible outcomes for your patients and to make a lasting impact on their journey toward improved health and well-being. Thank you for choosing Mastering Bariatric Surgery as your guide. We wish you success, fulfillment, and continued growth in your pursuit of excellence in bariatric surgery. Sincerely, Dr. Atef Ahmed. Early ambulation. Tip: encourage early ambulation post-surgery. Explanation: mobilizing patients soon after surgery reduces the risk of complications like deep vein thrombosis and accelerates recovery. Nutrition management. Tip: monitor and guide patients in their postoperative nutrition. Explanation: proper nutrition is essential for weight loss and overall health. Nutritional deficiencies can occur after surgery, so monitoring and supplementation are critical. Long-term follow-up. Tip: establish a robust long-term follow-up plan. Explanation: continued support and monitoring are essential for success and detecting potential complications early. Mental health support. Tip: address the psychological aspects of obesity. Explanation: offering counseling and support for mental health challenges related to obesity can improve patient outcomes and adherence to lifestyle changes. Consider revision surgery. Tip: be prepared for revision surgery if necessary. Explanation: Sometimes, initial bariatric procedures may not provide the desired results or complications may arise. Be ready to evaluate and perform revision surgeries when appropriate. Thorough preoperative evaluation. Tip: conduct a thorough preoperative assessment, including evaluating for sleep apnea and other comorbidities. Explanation: identifying and addressing underlying health issues helps optimize surgical outcomes and postoperative care. Intraoperative hemostasis. Tip: ensure meticulous hemostasis during surgery. Explanation: proper control of bleeding is critical to prevent postoperative complications, such as hematomas or anemia. Assess for gallbladder issues. Tip: assess the gallbladder during surgery and consider concurrent cholecystectomy if needed. Explanation: rapid weight loss after bariatric surgery can increase the risk of gallstone formation and gallbladder problems. Monitoring for nutritional deficiencies. Tip: monitor patients for nutritional deficiencies regularly. Explanation: patients may develop deficiencies in vitamins and minerals, such as vitamin B12 or iron, which can lead to long-term health problems if left untreated. Patient support groups. Tip: encourage patients to participate in support groups. Explanation: support groups can provide emotional support, share experiences, and help with long-term adherence to dietary and lifestyle changes. Adequate pain management. Tip: employ effective pain management strategies. Explanation: proper pain control enhances patient comfort, promotes early mobility, and reduces postoperative complications. Postoperative imaging. Tip: consider postoperative imaging, such as a contrast swallow study, to check for leaks. Explanation: imaging can detect leaks or obstructions early, allowing for prompt intervention if necessary. Addressing dumping syndrome. Tip: educate patients about dumping syndrome and how to manage it. Explanation: dumping syndrome can occur after certain bariatric procedures. Patients should understand its symptoms and dietary modifications to alleviate discomfort. Regular quality assurance. Tip: establish regular quality assurance and review processes. Explanation: continuously assess surgical outcomes and practices to improve patient care and safety. Anesthesia selection. Tip: collaborate closely with anesthesiologists to select the most appropriate anesthesia approach. Explanation: anesthesia considerations can vary based on the patient's health status and the chosen surgical procedure. Tailor anesthesia to minimize risks. Enhanced recovery protocols. Tip: implement enhanced recovery after surgery, ERAS, protocols. Explanation: ERAS protocols have been shown to improve patient outcomes by minimizing postoperative complications and accelerating recovery. Anticoagulation prophylaxis. Tip: develop a standardized protocol for perioperative anticoagulation prophylaxis. Explanation: reducing the risk of venous thromboembolism is crucial, so establish guidelines for anticoagulation therapy in bariatric surgery patients. Minimize operating time. Tip: strive to minimize the duration of surgery. Explanation: reducing operating time can lower the risk of complications and improve patient outcomes. Surgical site infection prevention. Tip: strictly adhere to sterile techniques and infection prevention protocols. Explanation: surgical site infections can be especially problematic in bariatric surgery. Preventing infections is vital for patient safety. Team communication. Tip: foster clear communication among the surgical team during the procedure. Explanation: effective communication helps prevent errors and ensures that everyone is aware of critical information. Addressing acid reflux. Tip: consider fundoplication if the patient has gastroesophageal reflux disease, GERD. Explanation: some bariatric procedures can worsen GERD. In such cases, fundoplication can be added to prevent reflux. Adjustable gastric band maintenance. Tip: regularly assess and adjust adjustable gastric bands. Explanation: These bands may require adjustments over time to optimize weight loss and reduce complications. Preventing strictures. Tip: be vigilant for anastomotic strictures and consider endoscopic dilation. Explanation: strictures can occur at surgical connections, affecting food passage. Timely intervention can prevent complications. Ethical considerations. Tip: adhere to ethical guidelines when performing bariatric surgery. Explanation: maintain ethical standards, including informed consent, respect for patient autonomy, and avoidance of conflicts of interest. Intraoperative evaluation of mesentery. Tip: carefully evaluate the mesentery for signs of fat or vascular abnormalities. Explanation: examining the mesentery helps prevent complications related to inadequate blood supply or fatty deposits. Avoiding vessel injury. Tip: pay meticulous attention to vascular structures during surgery. Explanation: inadvertent injury to blood vessels can lead to serious complications. Take extra care when dissecting near major vessels. Routine hiatal hernia repair. Tip: consider repairing hiatal hernias routinely during certain procedures. Explanation: hiatal hernias can coexist with obesity and may contribute to reflux. Repairing them simultaneously can improve patient outcomes. Postoperative pain control. Tip: utilize multimodal pain management strategies. Explanation: combining various methods, such as local anesthetics and non-opioid medications, can reduce opioid use and postoperative pain. Thromboprophylaxis for high-risk patients. Tip: identify high-risk patients for venous thromboembolism and provide appropriate thromboprophylaxis. Explanation: some bariatric surgery patients have an elevated risk of blood clots, so tailor prophylaxis based on individual risk factors. Managing postoperative nausea and vomiting. Tip: have a protocol in place for managing postoperative nausea and vomiting. Explanation: these symptoms can be distressing for patients. A standardized approach ensures timely relief. Long-term diet and exercise counseling. Tip: continuously counsel patients on diet and exercise for lifelong success. Explanation: encouraging healthy habits is essential for long-term weight maintenance and overall well-being. Recognizing and managing psychological challenges. Tip: be vigilant for signs of depression, anxiety, or eating disorders in patients. Explanation: psychological challenges are common in bariatric patients. Early detection and intervention are critical. Thorough documentation. Tip: maintain detailed and accurate surgical records. Explanation: comprehensive documentation helps in postoperative care, follow-up, and potential legal issues. Stay informed. Tip: stay updated with the latest research and guidelines in bariatric surgery. Explanation: the field is constantly evolving. Continuing medical education is essential to provide the best care. Preventing internal hernias. Tip: be vigilant for internal hernias in postoperative patients. Explanation: internal hernias can occur after certain bariatric procedures. Early detection and surgical correction are crucial. Resolving port site hernias. Tip: repair port site hernias promptly if identified. Explanation: port site hernias can develop at trocar entry points. Address them to prevent complications. Clear communication with patients. Tip: maintain open and honest communication with patients. Explanation: address patient concerns and expectations clearly to build trust and improve adherence to postoperative recommendations. Monitor for dumping syndrome. Tip: routinely assess for dumping syndrome during follow-up visits. Explanation: dumping syndrome can develop or change over time. Address it with dietary and lifestyle modifications. Reevaluate and adjust as needed. Tip: periodically reassess and adjust the bariatric procedure, if necessary. Explanation: Some patients may require revision or conversion to a different procedure for optimal outcomes. Collaborate with dietitians. Tip: collaborate closely with dietitians for nutrition management. Explanation: dietitians can provide valuable guidance for patients in achieving and maintaining proper nutrition. Addressing excess skin. Tip: discuss body contouring procedures with patients who experience excess skin after significant weight loss. Explanation: excess skin can impact quality of life. Referral for body contouring surgery may be appropriate. Preventing marginal ulcers. Tip: minimize the risk of marginal ulcers by avoiding nonsteroidal anti-inflammatory drugs, NSAIDs, post-surgery. Explanation: NSAIDs can increase the risk of ulcers at the surgical site. Educate patients to choose alternative pain management options. Addressing weight regain. Tip: develop a strategy to address weight regain in patients who don't meet their weight loss goals. Explanation: some patients may experience weight regain over time. Be prepared to evaluate and provide guidance for re-establishing weight loss. Incorporate robotic-assisted surgery. Tip: consider using robotic-assisted surgery for complex cases. Explanation: robotic-assisted surgery can enhance precision in challenging cases, reducing complications. Manage expectations. Tip: set realistic expectations for patients regarding postoperative weight loss and body image. Explanation: ensuring patients have accurate expectations can reduce frustration and improve long-term adherence. Understand insurance requirements. Tip: familiarize yourself with insurance requirements and documentation for bariatric surgery. Explanation: insurance policies vary, and proper documentation is crucial for reimbursement and patient coverage. Multimodal nausea prevention. Tip: use multimodal approaches to prevent postoperative nausea and vomiting, PONV. Explanation: combining antiemetic medications and non-pharmacological interventions can minimize PONV. Nutritional supplementation. Tip: prescribe appropriate nutritional supplements to meet individual patient needs. Explanation: patients may require different supplements based on their specific nutritional deficiencies. Gastric band adjustments. Tip: schedule regular gastric band adjustments to optimize weight loss. Explanation: fine-tuning the band's tightness is essential for patient success. Address surgical complications swiftly. Tip: swiftly address and manage surgical complications such as leaks, strictures, or hemorrhage. Explanation: prompt intervention can prevent complications from escalating and improve patient outcomes. Consider pregnancy post-surgery. Tip: discuss family planning with female patients and consider postponing pregnancy until weight loss stabilizes. Explanation: pregnancy after bariatric surgery requires careful monitoring due to potential nutritional challenges. Risk assessment. Tip: conduct a comprehensive preoperative risk assessment, including evaluating cardiovascular and pulmonary function. Explanation: assessing patients' overall health helps identify potential complications and allows for better preparation. Addressing OSA. Tip: if a patient has obstructive sleep apnea, OSA, ensure proper preoperative and postoperative management. Explanation: managing OSA is crucial to reduce the risk of complications such as respiratory issues during surgery and in the recovery period. Patient education on dumping syndrome. Tip: educate patients about the symptoms and management of dumping syndrome. Explanation: patients should be aware of how to identify and cope with this common postoperative condition. Smoking cessation. Tip: encourage patients to quit smoking before surgery and support their cessation efforts. Explanation: smoking can increase surgical risks and hinder postoperative recovery. Addressing alcohol use. Tip: be vigilant for alcohol misuse post-surgery and provide support and counseling when needed. Explanation: some patients may develop alcohol-related problems after surgery. Monitoring for hypoglycemia. Tip: monitor patients for hypoglycemia, especially after procedures that affect glucose metabolism. Explanation: some bariatric surgeries can lead to hypoglycemia, which requires careful management. Folate supplementation. Tip: prescribe folate supplements to female patients of childbearing age. Explanation: folate is essential for fetal development, and patients should be advised to take supplements if pregnancy is planned. Laparoscopic skills. Tip: continuously refine laparoscopic skills and stay up to date with the latest minimally invasive techniques. Explanation: mastery of laparoscopic techniques can improve surgical outcomes and patient recovery. Psychological support for body image. Tip: offer psychological support for patients dealing with body image issues after significant weight loss. Explanation: patients may experience emotional challenges related to their changed appearance, and counseling can help. Stoma care. Tip: educate patients on proper stoma care if they undergo procedures like gastric bypass or sleeve gastrectomy. Explanation: teaching patients to care for their surgical connections can prevent complications. Thorough informed consent. Tip: ensure patients have a thorough understanding of the risks and benefits through informed consent. Explanation: comprehensive informed consent discussions help patients make informed decisions and mitigate potential legal issues. Management of hernias. Tip: be vigilant for incisional and ventral hernias in post-bariatric surgery patients. Explanation: patients may be at higher risk for these types of hernias, so monitor and address them promptly. Preventing malnutrition. Tip: continuously assess nutritional status and educate patients on maintaining adequate protein intake. Explanation: malnutrition is a concern, and protein intake is critical for wound healing and overall health. Tracking weight loss progress. Tip: use a standardized system to track and document patients' weight loss progress. Explanation: consistent tracking helps identify trends and enables timely interventions if necessary. Collaborate with physical therapists. Tip: collaborate with physical therapists to develop personalized exercise plans. Explanation: exercise is a vital component of long-term success. Tailored programs can enhance patient adherence. Handling non-responders. Tip: develop strategies for patients who do not achieve expected weight loss. Explanation: some patients may not respond as anticipated. Be prepared to assess and adjust treatment plans. Assess bone health. Tip: monitor bone health and consider supplements if necessary. Explanation: bariatric patients are at risk of bone-related issues, so regular assessment and supplementation may be needed. Promote hydration. Tip: educate patients on the importance of hydration and monitor for dehydration. Explanation: maintaining proper hydration is crucial for overall health and can be challenging post-surgery. Postoperative imaging for complications. Tip: utilize imaging studies like CT scans or upper GI series if complications are suspected. Explanation: imaging can help diagnose and guide treatment for postoperative issues. Patient advocacy. Tip: be an advocate for your patients in the healthcare system, ensuring they receive appropriate care and support. Explanation: patients may face challenges with insurance, access to specialists, or other issues that require advocacy. Prevention of postoperative constipation. Tip: address and manage postoperative constipation to improve patient comfort. Explanation: changes in diet and activity levels can lead to constipation. Educate patients on strategies to prevent it. Vitamin D assessment. Tip: monitor and supplement vitamin D levels in patients, especially those with limited sun exposure. Explanation: adequate vitamin D is essential for bone health and overall well-being. Special considerations for adolescents. Tip: adapt bariatric surgery techniques and follow-up protocols for adolescent patients. Explanation: bariatric surgery in adolescents requires unique considerations and a specialized approach. Mitigate food aversion. Tip: work with dietitians to help patients overcome food aversion and diversify their diets. Explanation: some patients may develop aversions to specific foods. A dietitian can assist in finding alternative options. Psychological assessment pre-surgery. Tip: conduct thorough psychological assessments before surgery. Explanation: identifying underlying psychological issues ensures patients are prepared for the emotional aspects of postoperative life. Handling inadequate weight loss. Tip: develop a plan for patients experiencing inadequate weight loss. Explanation: some patients may not achieve expected weight loss. Transition to solid foods. Tip: gradually transition patients to solid foods post-surgery, guided by dietitians. Explanation: safe introduction of solid foods minimizes the risk of complications. Managing adverse reactions. Tip: educate patients about potential adverse reactions to foods or supplements and how to manage them. Explanation: some patients may experience intolerance or allergies to certain foods post-surgery. Evaluate gastrointestinal motility. Tip: assess gastrointestinal motility in patients with persistent gastrointestinal symptoms. Explanation: motility issues can affect digestion and quality of life for some patients. Support for emotional eating. Tip: provide strategies for patients struggling with emotional eating. Explanation: emotional eating can be a challenge. Offer guidance and resources for addressing it. Recognize signs of nutritional deficiency. Tip: train your team to recognize early signs of nutritional deficiency. Explanation: early detection and intervention can prevent severe complications related to nutrient deficiencies. Obesity-related comorbidity assessment. Tip: thoroughly assess and manage obesity-related comorbidities such as diabetes, hypertension, and sleep apnea. Explanation: managing these conditions effectively can improve surgical outcomes and overall patient health. Optimize wound healing. Tip: implement strategies to optimize wound healing, such as nutrition support and glycemic control. Explanation: bariatric surgery patients may have impaired wound healing, so proactive measures are essential. Psychological pre-screening. Tip: conduct psychological pre-screening to identify patients who may need additional mental health support. Explanation: identifying patients with underlying mental health concerns ensures they receive appropriate care. Telemedicine and follow-up care. Tip: consider using telemedicine for postoperative follow-up care, especially for remote or high-risk patients. Explanation: telemedicine can improve access to care and patient compliance with follow-up appointments. Addressing regain. Tip: establish protocols for addressing weight regain, including lifestyle modification and potential revision surgery. Explanation: weight regain is a possibility. Having a plan in place ensures a proactive response. Smoking cessation programs. Tip: implement smoking cessation programs for patients who smoke preoperatively. Explanation: smoking cessation can improve surgical outcomes and overall health. Cultural sensitivity. Tip: be culturally sensitive and consider cultural factors in patient care. Explanation: patients from different cultural backgrounds may have unique dietary preferences and beliefs. Respect these while providing guidance. Stay current on guidelines. Tip: continuously review and adhere to the latest clinical guidelines and consensus statements in bariatric surgery. Explanation: guidelines are regularly updated to reflect the best practices and evidence-based care. Encourage peer networking. Tip: encourage patients to connect with others who have undergone bariatric surgery. Explanation: peer support can provide valuable insights and motivation for patients on their weight loss journey. Medication adjustments. Tip: adjust medications appropriately post-surgery to account for changes in absorption and metabolism. Explanation: many medications may need dosage modifications after bariatric surgery due to altered physiology. Regular psychological support. Tip: Offer ongoing psychological support to address body image concerns and mental health challenges. Explanation: supporting patients through the emotional aspects of significant weight loss is crucial for their overall well-being. Avoid premature surgery. Tip: ensure that patients have made adequate lifestyle changes before considering bariatric surgery. Explanation: surgery should be viewed as a last resort, and patients should exhaust non-surgical options first. Documentation of consent discussions. Tip: maintain detailed records of informed consent discussions with patients. Explanation: clear documentation is essential in case of disputes or legal issues. Minimize surgical site infections. Tip: employ strict aseptic techniques and antibiotic prophylaxis to minimize surgical site infections. Explanation: preventing infections is paramount in the postoperative period. Handle postoperative hair loss. Tip: inform patients about the possibility of temporary hair loss post-surgery. Explanation: rapid weight loss can lead to temporary hair loss. Educating patients can alleviate concerns. Addressing food intolerances. Tip: help patients identify and manage food intolerances that may develop post-surgery. Explanation: some foods may become intolerable post-bariatric surgery, necessitating dietary adjustments. Address regurgitation and aspiration. Tip: educate patients on the risk of regurgitation and aspiration and how to prevent it. Explanation: vigilance in avoiding these risks can prevent potentially life-threatening complications. Prevention of maladaptive eating. Tip: teach patients strategies to prevent maladaptive eating behaviors. Explanation: patients should learn to differentiate between physical hunger and emotional triggers. Personalized exercise plans. Tip: collaborate with physical therapists to create individualized exercise plans for patients. Explanation: tailoring exercise regimens to each patient's needs and abilities enhances compliance and outcomes. Early ambulation. Tip: encourage early ambulation post-surgery. Explanation: mobilizing patients soon after surgery reduces the risk of complications like deep vein thrombosis and accelerates recovery. Nutrition management. Tip: monitor and guide patients in their postoperative nutrition. Explanation: proper nutrition is essential for weight loss and overall health. Nutritional deficiencies can occur after surgery, so monitoring and supplementation are critical. Long-term follow-up. Tip: establish a robust long-term follow-up plan. Explanation: continued support and monitoring are essential for success and detecting potential complications early. Mental health support. Tip: address the psychological aspects of obesity. Explanation: offering counseling and support for mental health challenges related to obesity can improve patient outcomes and adherence to lifestyle changes. Consider revision surgery. Tip: be prepared for revision surgery if necessary. Explanation: sometimes, initial bariatric procedures may not provide the desired results or complications may arise. Be ready to evaluate and perform revision surgeries when appropriate. Thorough preoperative evaluation. Tip: conduct a thorough preoperative assessment, including evaluating for sleep apnea and other comorbidities. Explanation: identifying and addressing underlying health issues helps optimize surgical outcomes and postoperative care. Intraoperative hemostasis. Tip: ensure meticulous hemostasis during surgery. Explanation: proper control of bleeding is critical to prevent postoperative complications, such as hematomas or anemia. Assess for gallbladder issues. Tip: assess the gallbladder during surgery and consider concurrent cholecystectomy if needed. Explanation: rapid weight loss after bariatric surgery can increase the risk of gallstone formation and gallbladder problems. Monitoring for nutritional deficiencies. Tip: monitor patients for nutritional deficiencies regularly. Explanation: patients may develop deficiencies in vitamins and minerals, such as vitamin B12 or iron, which can lead to long-term health problems if left untreated. Patient support groups. Tip: encourage patients to participate in support groups. Explanation: support groups can provide emotional support, share experiences, and help with long-term adherence to dietary and lifestyle changes. Adequate pain management. Tip: employ effective pain management strategies. Explanation: proper pain control enhances patient comfort, promotes early mobility, and reduces postoperative complications. Postoperative imaging. Tip: consider postoperative imaging, such as a contrast swallow study, to check for leaks. Explanation: imaging can detect leaks or obstructions early, allowing for prompt intervention if necessary. Addressing dumping syndrome. Tip: educate patients about dumping syndrome and how to manage it. Explanation: dumping syndrome can occur after certain bariatric procedures. Patients should understand its symptoms and dietary modifications to alleviate discomfort. Regular quality assurance. Tip: establish regular quality assurance and review processes. Explanation: continuously assess surgical outcomes and practices to improve patient care and safety. Anesthesia selection. Tip: collaborate closely with anesthesiologists to select the most appropriate anesthesia approach. Explanation: anesthesia considerations can vary based on the patient's health status and the chosen surgical procedure. Tailor anesthesia to minimize risks. Enhanced recovery protocols. Tip: implement enhanced recovery after surgery, ERAS, protocols. Explanation: ERAS protocols have been shown to improve patient outcomes by minimizing postoperative complications and accelerating recovery. Patient selection. Tip: careful patient selection is crucial. Consider patients with a BMI above 40 or above 35 with comorbidities. Explanation: bariatric surgery is most effective for patients who meet specific criteria, ensuring they will benefit from the procedure and manage potential risks. Multidisciplinary team. Tip: establish a multidisciplinary team including dietitians, psychologists, and exercise physiologists. Explanation: collaborative care addresses the complex needs of bariatric patients, optimizing long-term success and compliance. Preoperative education. Tip: provide comprehensive preoperative education to patients. Explanation: educating patients about the procedure, lifestyle changes, and potential complications enhances their understanding and commitment. Laparoscopic technique. Tip: utilize minimally invasive laparoscopic techniques. Explanation: laparoscopy reduces postoperative pain, shortens hospital stays, and leads to quicker recovery compared to open surgery. Staple line reinforcement. Tip: consider using staple line reinforcement materials like buttressing or oversewing. Explanation: reinforcement reduces the risk of staple line leaks, a potentially serious complication. Leak testing. Tip: perform a leak test before completing the surgery. Explanation: leak testing with methylene blue or air ensures the integrity of the surgical connections, preventing postoperative leaks. Conclusion of my book Mastering Bariatric Surgery, Insider Tips and Surgical Strategies. As we reach the conclusion of Mastering Bariatric Surgery, Insider Tips and Surgical Strategies, we hope that this book has served as a valuable resource in your journey to becoming a proficient and compassionate bariatric surgeon. The pages you've explored contain a wealth of knowledge and insights gathered from experienced professionals in the field, aimed at empowering you with the tools to provide exemplary care to your patients. Bariatric surgery represents a remarkable intersection of medical science, surgical expertise, and patient-centered care. It's a discipline that offers transformative potential for individuals struggling with obesity, but it also demands a deep commitment to lifelong learning and a dedication to the well-being of those under your care. Throughout this book, we've discussed the intricacies of patient selection, surgical techniques, postoperative care, and the critical importance of addressing the emotional and nutritional needs of bariatric patients. We've shared tips and tricks that can enhance your surgical skills, refine your patient management, and ultimately lead to better outcomes. As you embark on or continue your journey as a bariatric surgeon, we encourage you to carry forward the principles of excellence, empathy, and innovation that are central to this field. Each patient you encounter is unique, and your ability to tailor your approach to their specific needs is what sets you apart as a master of bariatric surgery. Remember that bariatric surgery is not only about helping individuals lose weight, it's about improving their quality of life, enhancing their health, and offering them the opportunity for a brighter, healthier future. The impact you make as a bariatric surgeon extends far beyond the operating room, shaping the lives of your patients and their loved ones. We hope this book has inspired you to approach your practice with a commitment to continuous improvement, a dedication to patient safety, and an unwavering focus on the long-term well-being of those you serve. Bariatric surgery is a dynamic and evolving field, and your contribution to it is both meaningful and transformative. Thank you for joining us on this journey through Mastering Bariatric Surgery. We wish you every success in your pursuit of excellence, and above all, we hope you find fulfillment in the remarkable and rewarding field of bariatric surgery. With heartfelt appreciation and warmest regards, Dr. Atef Ahmed.